I'm Breanna Lathrop. I'm the Chief Operating Officer of Good Samaritan Health Center in Atlanta, Georgia, and I also practice here as a family nurse practitioner. We provide free and reduced cost healthcare to people that would otherwise lack healthcare and larger healthcare services due to poverty or lack of health insurance. I started at St. Oles for my undergrad and joined the program of nursing there at St. Oles my junior year, and just fell in love with the profession. I had a wonderful experience. And as I was at St. Oles, one of the most meaningful experiences of my time there is I started volunteering for the Northfield Free Clinic and loved what I was doing, but found myself really frustrated that such a thing needed to exist. Why were we running a free clinic out of the basement of a church in a nation that clearly has resources, and just juxtaposing that experience versus what I was seeing in the hospital, where there seemed to be ample supplies and medications, and just really felt unsettled by that inequity. As I looked towards, graduating and leaving St. Oles, I started looking at programs where I could get my degree as a nurse practitioner, but also better understand the healthcare system. And so I found myself at Emory because they offered a dual degree program where I could do my clinical degree as a family nurse practitioner, and I could do a master's in public health, specifically in health policy. I feel like my interest in drawing towards social justice as a young person, as a high schooler and a college student, really led me into healthcare and nursing because it seemed to be such a tangible way to do that work and to meet an expressed need. And I think some of the tension for me has always been, do you just keep working upstream? Do I try to change more policies, or do I spend more time in administration or more time in writing or consulting? And leave patient care? Or do I put every ounce of time I have into direct patient care? Social justice is all of that. It's saying, what skill do I have in this moment? What opportunity do I have today to use some piece of me, to use some piece of my time to contribute and to work against some of the wrong that's going on in our world? When I talk to students that are like, I want to do public health, or I want to do nursing, or I want to work in the safety net, one of the first things I tell them is start by volunteering and start to really understand the safety net in the community. I know for me, the time I spent with others that were launching or running charitable care organizations really transformed my thinking and certainly helped me be farther along in my journey than if I had just showed up at a clinic on day one. I think the other piece of advice I would offer students is that it's not just about where you land that first job or even that second job, but it's about the experiences you are putting yourself in and creating that change you as a person. So my encouragement too is that if someone is interested in health and doesn't have a more traditional, I'm in the school of nursing, or I'm headed to med school, or I've got the MPH, that we still really need you, and that you may just offer a perspective and solutions that simply aren't going to come out of the more traditional healthcare, and that is of great value.